really blessed here on Studio 512 to be able to get in touch with real professionals when it comes to dealing with some pretty heavy issues. So we've got Dr. Paiman Ghafoori on the line today. He is a board-certified radiation oncologist at Austin CyberKnife. Good morning, Dr. Ghafoori.
Good morning.
Thank you so much for being here. Today, subject that we're focusing on is lung cancer. Can you talk to me a little bit about the current statistics for lung cancer?
I think it's still very important in this day and age to continue to discuss lung cancer because it is still a common cancer and it is by far the most common cause of cancer deaths in the United States. 27% of all cancer deaths are related to lung cancer.
Whoa, that's a big number.
Which is more than multiple other types of cancers combined.
For a couple of years, it seemed like we were working away from smoking and that sort of thing, but I know that that's not the only role that something could play in, for example, getting something like lung cancer. So it's surprising to hear that it's so prevalent. But let's talk a little bit about it. First of all, what are the benefits and, what makes it different to treat cancer with something like CyberKnife?
Well, CyberKnife is a way to deliver very pinpoint, precise radiation to the lung cancer. It allows the patient to be treated non-surgically, non-invasively, no downtime. It's evolved into a very, very effective tool for treating lung cancer, particularly for patients who cannot or will not undergo surgery for any reason.
And when I think about, all the traditional things that you hear about something like chemotherapy, it is that you are going to be more fatigued. It is invasive. It does really take an impact on your life. So to hear that you guys can treat so effectively cancer with so few treatments and so little downtime, it's really impressive to hear. Let's talk about recurrent lung cancer, though. First of all, what is it? And second of all, can you treat it?
Recurrent lung cancer is a clinical situation where someone has previously been treated for that lung cancer either with surgery or chemotherapy or even prior radiation therapy or a combination of those things, and it may come back in the lungs. That can be a very challenging situation, particularly because of the prior treatments that have taken place. CyberKnife is one of those situations that you can successfully apply this highly precise technology to very focally target the area of recurrence.
I know that sometimes cancer can spread. I mean, you could get it somewhere as a first site, and then it might actually spread into the lungs. So can you use CyberKnife to treat maybe like a second site of cancer, something like that, once you get it into your lungs?
The lungs are a common site for cancer to spread to, possibly from another site. It could be a lung cancer that spreads to other parts of the lung, but it could also be like a breast cancer or a colon cancer or another type of cancer that spreads to the lungs. CyberKnife can be used to treat areas in the lung that have tumor deposits from other sites of the body. What makes CyberKnife particularly unique for lung treatments is that it is a robotic device and the radiation source moves with lung motion or the breathing motion. It's the only type of device that can track a tumor in real time to account for the respiratory motion. That allows the tumor to be treated with the minimum amount of excess radiation going to normal tissues. And that is what makes treatments better tolerated, fewer side effects, and allows us to treat the actual tumor to a higher dose, which makes the treatments more effective. We want patients to know that we are and continue to be available during the COVID pandemic. We have very strict and excellent protocols in place to protect patients, protect the providers, so that we have the utmost ability to continue our services without interruption and convenience for the patient by being able to do telemedicine visits for post-treatment follow-ups as well as evaluations prior to treatment.
Yeah, really important services, life-saving services, and we are so grateful for what you're able to do for our community, Doctor. I know you're busy. I know you've got to put your PPE back on and get back out there, so I don't want to keep you all morning, but we really do appreciate you taking the time to educate us a little bit this morning. Thank you so much.
Thank you.
Austin CyberKnife is located on I-35 near the Dell Seton Medical Center at the University of Texas. Call them 512-324-8060 or go to austincyberknife.com for more info.